Lots of different factors. So number one, is the treatment truly the same? What I mean by that is a lot of these treatments are device dependent and operator dependent and patient dependent. So operator dependent is, are they using the correct settings? Are they assessing the patient appropriately in terms of the depth of the treatment? Then you have the device. So different devices are very different in terms of how strong they are, in terms of energy they emit, if it's a device. And finally, patient dependent. Everyone's skin and anatomy is different. So you might have more sensitive skin, you might have a darker skin type. It is so dependent, and that's why it does truly matter. Number one, to choose your patient appropriately. Number two, see the right clinician. And number three, carry out the appropriate instructions after your treatment.
So another example is injectables, like for example, lip filler. We might have patients coming in saying, I don't want lip filler because I don't want to look like that. And it's an interesting conversation to have, because a lip filler treatment done on one person or in one clinic is not the same as a lip filler treatment done elsewhere. And there are factors like the product choice, the starting anatomy and lip shape of the patient, the amount that's injected, the placement of the product, the healing of the tissue, whether the patient has, for example, had previous surgery in the area or previous dissolving in that area. All of these factors can impact how lip filler would settle within the tissue.
It's also patient expectations. So what I find is, and I make this very clear to patients, that our aim, for example, is a more rejuvenated appearance of the lips, okay, not to change the shape of the lips. But the issue is sometimes patients want bigger and bigger lips, or they will see different providers, and as a result, then they have a much higher risk of migration or the lips looking more deformed.